Okay, welcome back to Muthu Integrative Medicine in Pulmonary Clinic. Well, we have two parts done, one more part to go, all right. And I will have these, videos also split into smaller sections for you guys so that you have tidbits and pearls so that you can just watch for 2 minutes, 3 minutes here and there. Okay, just takeaway points. So now we continue on to evidence that is showing that, what are the packages that we can offer to patients instead of drugs, right? There were two trials that recently came out as unfortunately negative studies. These are huge pharmaceutical industry trials, spending a lot of money getting vitamin D and fish oil and recruiting so many patients, and unfortunately came back as negative. It could not reduce for the first heart failure hospitalization risk, or had no benefits in reducing major cardiovascular events or cancer. And the reason is because the product here is a pill. Unfortunately, a pill doesn't work. Whereas a form of diet, lifestyle, and medicine and discipline, if you come with a package and offer it to a patient, that is called as a whole systems research. For example, the early goal-directed therapy you might have heard for sepsis, treatment of sepsis, we have a bundle approach. We give a bundle to each patient saying, this patient needs to get these things done in this period of time, which is getting fluids, antibiotics within the first hour, and so on. So that is called as a whole systems research, or also called as a pragmatic trial, where you cannot study this as a single modality, but actually as a group of services provided. So that's what is seen in systems such as Ayurveda or Chinese medicine. For example, acupuncture goes along with also advising on the diet, cold and hot, dry and oily. Those are the opposites, the rules of opposites. Those are also offered at Chinese medicine consultations, and so on, with even other traditional integrative medicine practices. If you go out into the community right now, and if you see the way asthma or other diseases are being practiced and managed, you'll be amazed at what integrative medicine is offering. Unfortunately, there is a little bit of um, manipulation and marketing. For example, there is some expenditure involved in trying to get stool studies looking at microbiota. Those are all going on, and still things are trying to go towards pill driven. In fact, now they're trying to make a pill that consists of so many bacteria, and I don't think it's going to work that way. Again, it has to come from within. Okay, our body has to do it itself with the correct kind of support. Well, I'm hopeful that at least there will be some positive outcomes from pill trials that are looking at microbiome research. So yeah, NEJM came out with a paper that said that, hey, maybe we don't need randomized control trials before we have to offer something to our patient. Not all the times are we able to perform randomized control trials. Well, for example, certain things cannot be blinded from people. If I'm providing extra Ayurvedic care to you or extra Chinese medicine, sometimes you can create a sham control arm, but sometimes it's not possible. So far, there are 5 categories or characteristics that need to be met in such a way that, hey, I'm ready to offer this to my patients and I don't have a randomized control trial. So things that are compelling based on a foundation concept, large effect sizes on early clinical studies, well understood, typically poor outcome with the current management that we have, availability of one or more concurrent or historical control groups, and use of clinical or validated surrogate primary endpoints that are very commonly used, right? So what do we have for asthma from complementary and alternative medicine? Well, we have Maureen George, who's doing an amazing job from Columbia University here in New York. And she has put together 75 studies in total out of so many more studies that were researched. And looks like less than 20 RCTs have been conducted so far that are looking at different things: acupuncture, herbs, supplements, yoga, meditation for asthma among adults as well as pediatrics. But unfortunately, none so far documenting Ayurveda as a whole systems research in a randomized controlled trial format. Okay, and I would like you to go into this particular paper and look into the individual studies if you are really interested in looking at, okay, what are the outcomes that acupuncture has looked at? What are their, did they do only acupuncture, or did they also offer dietary advice on top of the acupuncture? And did they offer Tai Chi? Did they offer exercise like meditation or relaxation? Right. However, we have one amazing clinical trial from Ayurveda looking at asthma specifically. And this study is called a proof of concept pragmatic trial. Okay, it's from Kalpana Joshi et al. And wonderful study. 76 patients, okay, with asthma. And what they did was they obtained baseline FVC, FEV1, peak flow, ACQ scores, IgE eosinophils, as well as Th2 markers, Th1 markers, pro-inflammatory, and immunosuppressive agents. So you see there are key aspects of Ayurvedic interventions that they have given here: Pachana, Anuloma, Abhyanga, Svedana, Shamana, and Rasayana. An example would be Abhyanga is basically applying oil before you go to a shower, right? Rasayana is herbs. So they had a comprehensive whole system package that was offered to these patients based on pulse exam or just baseline constitution analysis, just the same questions that I mentioned to you recently. About digestion, what kind of personality you are, and so on. VPK, basically, giving them a score and then giving accordingly. And this trial actually divided these patients into Kapha versus Vata, because those were the most common types. And most of them were actually Kapha. 50 were Kapha and 26 or something like that were Vata. And what did they find? The same patients, okay, were looked at after the treatment. And they do have some control patients here, just to look at the cytokine data, okay, just to have a control for the cytokine studies. And so after treatment, you see FVC improved from 72% predicted to 85% predicted. 59 FEV1% predicted improved to 65%. These were all, you see the 3 asterisks there, which is p less than 0.0001, right? These are very statistically significant. And clearly I can say, looking at these, definitely I would go for clinically significant difference, also minimal clinically important difference, MCIDs, right? We're trying to still get a good estimate of MCID for asthma. So peak flow, 3.2 liters per minute improved to 3.55 liters per minute, okay? So if you want a better estimate of that number, liter per minute, 3.2. So if you put it as seconds, right, 60 seconds, somewhere around 180 point something, improved to 180, 190 probably, or 200. Yeah, that was statistically significant, and I don't know if the peak flows really met minimal clinically important differences or not. So ACQ scores, again, 2.64 dropped down to 0.4. That's pretty big drop. And immunological data in IgE levels dropped from 441 to 324, eosinophils from 3.54% to 2.32%. More importantly, guess what they did? They showed that these guys not only improved with their parameters of FEV1 and FVC, but also showed improvement in Th2 and Th1 markers. Pro-inflammatory markers were down and immunosuppressive markers were up. Right, so this is a proof of concept trial that showed that this was not this did not happen purely based on lung mechanics, but also at the level of the cytokines. And what do we have here? We have a whole genome expression that is looking at biochemical parameters, because conventional medicine looks at biochemical parameters in blood tests. That's the most microscopic level that we have been able to reach, is looking at blood tests, looking at LDL for metabolism, cholesterol, VLDL and HDL, and so on. And what do they say? Well, Prakriti, which is body constitution, and 320 healthy individuals, and 120 of them were monodoshic, which is just predominantly V or P or K, and 200 were combinations. And they looked at 33 different biochemical tests, and out of which 15 of them in males and only 4 in females came back as significantly correlating with one type of phenotype, which is, say, for example, total cholesterol tended to be high in people who were either all three tridoshic or especially kapha, because we know kapha people slow metabolizers, right? Similarly, another example would be hemoglobin levels were high in people who had pitta predominant, because pitta fire blood. It's known that pitta have high metabolism in their background, and in general they're known to have hemoglobin, healthier levels of hemoglobin. And what else? Oh, prolactin. We know that we measure prolactin levels for seizure tendency, and Vata people, right? Vata people are known for their tendency or sensitivity for agitation or irregularity because of the nature of the wind and the space. And therefore, here they noticed that prolactin levels were high for people who had Vata predominance. Not only that in biochemical, but also back to the genome in form of mRNA transcripts and regions in the genome, they found that certain genes were overexpressed, right? For example, the red ones, ATP biosynthesis, ribonucleotide biosynthesis, metabolism, anything that was related to metabolism was with kapha, right? Kapha predominance. And people who had, say, for example, in transportation, as you see in the right corner down there, substrate-bound cell migration, each of these Prakriti constitutional elements had a representation back all the way to the genome. And we know that these individual elements in nature go down all the way to something called the unified field, right? Unified field is the most subtle form of energy, the final product of metabolism. And beyond that is, we are able to see in the nanospace, Vata, Pitta, and Kapha. Above that are the individual elements, then the genome, which is what we can see as the most microscopic nature at this time, right? And quantum theory has appreciated the same thing here. If there was one thing that you can take away from today's lecture, I would recommend this to all your patients: just hot water sipping. Okay, why don't we continue this same topic on to the next video, and I will let you spend some time on this. Try to reprocess this information. Thank you.